In a special episode of The Pour Over today, we're explaining the debate about healthcare, including where VP Harris and former President Trump stand. This is the 13th episode of our election collection, designed to help us grow in understanding and compassion on key 2024 election topics. Healthcare costs top the list of expenses Americans are fretting over. 3 in 4 adults say they are very or somewhat worried about being able to afford unexpected medical bills or the cost of healthcare services for themselves or their families. At least 80% of voters say it is very important that White House hopefuls talk about their plans for healthcare costs on the campaign trail. So, what are the two sides saying in the run-up to November? We'll leave you in suspense and explain some key healthcare debate terms you should know. Medicaid, a healthcare program provided by federal and state governments for low-income Americans. Medicaid is the largest source of health coverage in the U.S. Medicare, a federally funded health insurance program for people ages 65 plus and younger people with disabilities. Single-payer healthcare, a system in which the government is the only payer of healthcare costs in place of private insurance, and covers all qualifying healthcare expenses from money collected through taxes. This system is used by 17 countries, including Bahrain, Canada, Cyprus, Denmark, Finland, Iceland, Italy, Japan, Kuwait, Norway, Portugal, Slovenia, Spain, Sweden, the United Emirates, and the United Kingdom. Medicare for All, a proposal for a single-payer healthcare program in the United States that would replace existing public and private options. Affordable Care Act, or ACA, also known as Obamacare. This legislation expanded access to Medicaid, created a regulated health insurance marketplace, and required insurers to offer coverage for pre-existing conditions. Since it was passed in 2010, the percentage of Americans with health insurance has risen from 84% to 92%. Universal health coverage, the belief that everyone should have access to quality health services without financial hardship. We'll be back with what Republicans and Democrats say after a quick break.
In partnership with Cambridge University, the 4th oldest university in the world, no big deal, CSB has created a new Bible designed to enhance readability for kids with all levels and varieties of reading challenges, like dyslexia or visual processing disorders. The CSB Grace Bible for Kids features innovative and academically tested typeface, layout, and design principles, and is perfect for use at home, church, and school. Dyslexia shouldn't keep kids from reading the Bible, and now it doesn't have to. Help every kid experience the truth of God's Word with the CSB Grace Bible for Kids. Launching November 1st and available now for 25% off when you pre-order through Lifeway.com with promo code TPOGRACE25. Pre-order today.
The Republican Party traditionally believes that free markets foster competition, improve patient experience, and drive healthcare costs down. Most Republicans oppose a single-payer system, arguing that the government will make healthcare more expensive, less efficient, and leave patients with fewer choices. While 66% of Republicans think health insurance is not the government's responsibility, 54% want federally funded programs for the elderly and poor to continue. Democrats generally believe that quality, affordable health care is a right, not a privilege, for every American. They are proud to be the party that passed Medicare, Medicaid, and the Affordable Care Act, and want to see these programs protected and expanded. Among Democrats, 54% favor a single-payer system like Medicare for All, while 33% say health insurance should be provided by a mix of private companies and government programs. Believers may respectfully disagree about who should cover the costs of healthcare, but we can agree that our bodies are a beautifully designed gift from the Lord. Stewarding that gift well means taking care of our bodies and compassionately caring for the physical needs of our neighbors. Psalm 139, 13 and 14 says, "For it was you who created my inward parts. You knit me together in my mother's womb. I will praise you because I have been remarkably and wondrously made. Your works are wondrous, and I know this very well. And now, candidate stances. Vice President Harris aims to expand healthcare to cover more Americans, building upon Presidents Obama and Biden's policies. During her 2019 campaign, she supported Medicare for all, but said that in 2024 she would not push for single-payer insurance if elected president. She plans to maintain and grow the Affordable Care Act and to continue bringing down drug costs by allowing Medicare to negotiate with drug manufacturers. Former President Trump supports more choice, better care, and lower costs. While president, Trump lowered prescription drug prices, expanded access to affordable coverage, and signed a law to end surprise medical billing. He has promised not to cut Medicare spending and criticized the Affordable Care Act, saying he plans to replace it with something better and less expensive. That's all we have for today. Thanks for listening. If you're listening on the Apple Podcast app, give us a 5-star rating and drop a review. If you're listening on Spotify, give us a follow and hit the notification bell to never miss a new episode. We appreciate your support and hope you have a great day. We'll be back tomorrow with the regular news.
Hey, it's Kathleen from The Pour Over. Before you go today, I want to tell you about Keola. Imagine a mind and body practice to build strength and flexibility. Now imagine it's rooted in Christian principles. Keola's online, on-demand studio blends fitness with intentional time to give God your cares, focus on what He says, and grow in His Spirit. Head to the link in our show notes to start your free trial today and get a discount on your first month with code TPO.